Coming out of school, I did a little research to figure out what would be the best option for me. Were there more learning opportunities? I interviewed with several different residencies, and Henry J. Austin stood out to me. They had more of an integrated care, and it fit for me on what I was trying to do in my career. So I moved here specifically for that integrated program.
Initially, I started as a float nurse, and I just fell in love with the community, the vision, and the patients. I was promoted several times, and as a float nurse, then I became a unit manager, then a nursing supervisor, and then I went back to school and became a nurse practitioner. The journey to Henry J. Austin, it's amazing. The patients are amazing. I love the patients and I love our population.
The goal of a Nurse Practitioner Residency Program is to really create primary care experts, to say that the kind of knowledge we have, the kind of skills we have to treat the social determinants of health and their outcomes are not the things you learn in training, whether it's a medical residency if you're a physician or training for nurse practitioners. So we aim to create a residency so that we can share that expertise and really develop primary care providers who are fully equipped to deal with the kinds of patients we have and the kinds of treatment scenarios we have.
As a new graduate, the way the training model is, you actually have time with each different provider in different modality care. For instance, 1 week I'll be with pediatrics, 1 week I might be with behavioral health, 1 week I might be with women's care, and then the next week, I'll be integrated with everything.
So the nurse practitioner candidates who are working with me will, of course, receive special training in pharmacotherapy. Part of the challenge is that as a pharmacist, I'm not able to diagnose patients, and if there's a question of diagnosis, that's really where I need to bring in my primary care providers, like the physicians, the nurse practitioners, as well as the physician assistants.
Behavioral health is a specialty rotation for the NP program. This is going to give the resident an opportunity to be exposed to practicing in a holistic manner. So it's really a unique opportunity. It will allow the workforce and the residents who are being trained to go out with cutting-edge knowledge that is just going to be the way we practice in the future.
Our nurse practitioners and our physicians work side by side, and the distinction is not what your level of training is, but where are the skills that you have to really meet the patient where they are. So truly learning how to do patient-centered care also means that you get to learn many things.
So I see pediatrics, I see geriatrics, I see women's care, I see behavioral health, and I'm more confident than I was before I started. So being able to rotate through those different areas, it helped build up my confidence, because before getting here, pediatrics was not at all, I was not comfortable with pediatrics at all. But now I'm very confident with pediatrics.
You can do a lot here at Henry J. Austin as a nurse, but you can do a whole lot as a nurse practitioner. And then you're there more as a provider for a patient. Henry J. Austin is on the cutting edge of all integrated care, any innovation and ideas. To be a community healthcare center, we are on top of our game. We are well versed and ahead of many of our competitors in that essence.
The culture at Henry J. Austin is what makes it different from normal health centers. We are very passionate about our patients. We are very passionate about treating our patients as a whole, treating their mental health as well as their physical health. Trauma-informed care is a very big component of the care that we provide here at Henry J. Austin. That is not something that you can get from any health center.
Because what you're learning is guided by is what the patient needs. So nobody's going to say, oh, you can't learn how to do colposcopy, or you can't learn how to do pediatric care because you're just a nurse practitioner. What we're going to say is, we have many pediatric patients and many women who need those services. We're going to help you develop those skills because our patients need them. And that makes it a great learning environment as well. Over the years, we've collaborated in several different initiatives across the state with Zufall and Complete Care. We know that they provide the same kind of integrated health care, and that's why we chose them as our partners. And they also, as federally qualified health centers, are deeply committed to patient-centered care, and we look forward to the kind of training that residents can get at any of our locations.
Zufall Health Center is a federally qualified health center with 8 sites over 6 counties in central and northwest New Jersey. We take care of underserved communities throughout those areas. 90% of our patients are poor, are under 200% of the federal poverty line. About 2/3 of our patients are Hispanic or Latino, and about 50% of our patients do better in a language other than English. We have comprehensive services including pediatrics, women's health, adult medicine. This is a brand new innovative program. We are always looking for folks who are interested in working in our communities, particularly folks who are from the community and want to stay and serve the communities that they grew up in and the communities that they're from. Claudia is a really good example of that, and she's somebody who's from the area, who grew up in an immigrant community, trained here at Sioux Falls, and decided to stay on as a clinician.
I came to Sioux Falls as a student. I saw the opportunity to help a lot of underserved communities, and Sioux Falls gave me the opportunity to work with these communities, and I really like helping patients and diagnosing, evaluating, treating them, and this became my family. Sioux Falls has been my platform to become a better and knowledgeable nurse practitioner. It has helped me to be empowered and help other nurse practitioner students to be empowered to do a good job.
Working in community health, where patients are more underserved, where there's more pathology, where patients have less access to subspecialty care, it can feel overwhelming to come into that with not a lot of training on your back. So a year of residency is really a way to get a strong foundation in medicine so that you can come in and really provide excellent care for a career.
Since being a student here, it has been very gratifying to be hired as a family nurse practitioner and be able to help my community.
I think an NP resident should consider HJA because it's going to provide them a cutting-edge experience that they wouldn't normally have, that will allow them to heighten their clinical skills, their interpersonal skills. It will allow them to develop a working knowledge of how to work in a trauma-informed environment, how to understand how life has impacted people. And that's just going to make them a better practitioner as a whole. And it will allow them to also be very marketable because they're bringing that skill rather than having to learn it on the job. So going in with an integrated care background is really where the trend of healthcare is going.
It does open a lot of doors to you. So it can fast track your career. You're learning a lot over a short period of time. But for future employers, it really gives them the confidence that you know your stuff, that you have that extra experience that puts you above some of your cohorts. It kind of gives you that extra mentorship to really increase your self-confidence, your professionalism, and it gives you a lot of connections that you might not have elsewhere.
We're really looking for people to come here to see what community medicine is like, to see how wonderful it is to take care of patients who have tremendous need, and we want those people to stay.
I think the impact that I feel most proud of since I've been able to develop my skills here at Henry J. Austin, my primary goal for a community is to help that client develop skills where they can be independent for their health care.
It is unique because you're helping an underserved community and they really appreciate you taking care of them.
If you're interested in becoming or being a member of our team, the application itself is on the website. I love Henry J. Austin. I think I love the patients, I love the organization, I love the mission.
I would recommend anyone newly graduating to look into the residency program because you're going to get support, you're going to get guidance, and it will build up your skills and your confidence level.